The moment the chief surgeon's hand closed around her hair and yanked her head back, the entire emergency room seemed to freeze, as if time itself had been shocked into silence. Fluorescent lights hummed overhead, monitors beeped steadily, and the smell of antiseptic hung thick in the air, but all of it faded beneath the raw, humiliating violence of that single act. A quiet nurse, barely noticed by most, stood trembling in the center of it all, her eyes wide not with anger, but with something far deeper and more dangerous, resolve. If you believe in kindness, second chances, and the power of doing what's right even when it's hard, take a moment right now to like this video, share it with someone who needs hope, subscribe to the channel, and tell us in the comments where you're watching from. Your support keeps stories like this alive. Her name was Emily Carter, and for 3 years she had walked the long white corridors of St. Anne's Hospital as softly as a shadow. She was known as dependable, silent, and endlessly patient, the kind of nurse who showed up early, stayed late, and never complained even when her feet ached or her heart felt heavier than her scrubs pockets full of pens and gloves. Most people barely noticed her unless they needed something done quickly and without fuss. She listened more than she spoke, absorbed harsh words without responding, and believed deeply that her purpose was to heal, not to be seen. But beneath that calm surface lived a past shaped by hardship, sacrifice, and a promise she had made to herself long before she ever stepped into an emergency room. Emily had grown up watching her mother work double shifts as a hospital cleaner, hands cracked and bleeding from chemicals, eyes always tired but full of pride. Her mother used to say that hospitals were places where pain and miracles lived side by side, and that even the smallest act of care could mean everything to someone hanging on to life. When her mother died suddenly from an untreated illness because they couldn't afford proper care, Emily vowed she would become the kind of nurse who never let anyone feel invisible or powerless. That promise guided every step she took, even when the world tested her patience and dignity. The chief surgeon, Dr. Richard Holloway, was the opposite of everything Emily believed in. Brilliant, respected, and feared, he ruled the ER like a battlefield commander. His temper was legendary, his words sharp enough to cut deeper than any scalpel. Nurses flinched when he entered a room, residents avoided eye contact, and administrators looked the other way because his success brought prestige and money to the hospital. Mistakes were met with humiliation, not guidance, and respect was something he demanded, never earned. Emily had endured his outbursts many times, lowering her eyes and focusing on her tasks, telling herself that patience mattered more than pride. That night, the ER was overwhelmed. Ambulances arrived one after another, victims of a multi-car accident soaked in blood and shock. The air buzzed with urgency, stretchers crowded the halls, and every heartbeat seemed to echo through the chaos. Emily moved swiftly from patient to patient, her hands steady, her mind clear, doing everything she could to keep people alive. One patient, a young boy no older than 10, had been rushed in with internal bleeding. Emily noticed something was wrong with his vitals, a subtle change that others missed. She followed protocol, flagged the issue, and prepared for immediate intervention. But Holloway was already on edge, his patience worn thin by the relentless pressure. When he saw Emily adjusting equipment and insisting on a recheck, he exploded. In front of everyone, doctors, nurses, patients' families, he grabbed her hair and yanked her head back, his rage spilling into physical dominance meant to silence her. The room went deathly quiet. No one moved, no one spoke. Emily's scalp burned, her heart pounded, and for a split second, the frightened girl she once was threatened to resurface. But something inside her shifted. As he released her and stormed off, dismissing her concern, Emily didn't cry. She didn't shout, she stood there, breath shaking, and looked at the monitor again. The numbers told the truth. The boy was crashing. Every instinct she had, every lesson learned, every promise made to her mother rose up in that moment. Quietly, she acted. She alerted another physician, initiated emergency procedures within her scope, and refused to let the boy be ignored. Her calm persistence forced action, and within minutes, the true severity of the injury was undeniable. Emergency surgery saved the child's life. Word spread fast through the ER, not just about the save, but about what had happened before it. Nurses whispered, residents exchanged uneasy looks, and something long suppressed began to stir. Emily documented everything meticulously, her hands no longer trembling, her resolve unbreakable. She reported the incident, not with anger, but with clarity and truth. Hospital administration could no longer ignore what had been witnessed by so many. An investigation was launched, statements were taken, Security footage was reviewed. The image of the revered chief surgeon violently humiliating a nurse shattered the illusion of untouchable authority. During the weeks that followed, Emily faced isolation, doubt, and quiet pressure to back down. Some colleagues avoided her, afraid of consequences. Others thanked her in hushed voices, eyes filled with gratitude. She went home exhausted every night, questioning herself, replaying the moment over and over. But each time she thought of giving up, she remembered the boy who lived, the patients who depended on her courage, and the promise she had made all those years ago. The outcome stunned everyone. Dr. Holloway was suspended, then removed from his position pending further action. Policies were revised. Training programs were introduced. A culture of silence began to crack. Emily, the quiet nurse no one noticed, became a symbol of integrity and strength. Not because she sought attention, but because she chose to act when it mattered most. She continued working the same shifts, wearing the same scrubs, but something had changed in how people looked at her. There was respect now, and hope. Just before the ending, we want to ask you something important. Please comment below and share your thoughts about standing up for what's right, even when your voice shakes. Near the end of her shift one evening, Emily paused outside the pediatric ward and watched the young boy she had saved laugh softly with his mother. Tears filled her eyes, not from pain, but from a quiet triumph that no applause could ever equal. She understood then that true strength doesn't always roar. Sometimes it stands still, breathes deeply, and chooses courage anyway. If this story touched your heart, if it reminded you that even the quietest voices can change everything, please like this video, share it, and leave a comment. Your engagement helps spread stories that matter, and together, we keep kindness alive.